Thank you, Chairperson, for your introduction. And good morning, ladies and gentlemen, esteemed colleagues, and also future healthcare leaders. And where's Prof. Elvin? Okay, actually I feel mixed feelings after Dr. Elvin's talk, because I feel very happy because he covered the part of the comprehensive care, explained well what is not just only patient, not just only disease, but we also take care of patient in a more comprehensive, covering psychosocial, spiritual care. So I can save 5 minutes of my talk. Looking at the timekeeper keep on raising the cardboard, I feel so glad. So at least that part I can cut short. But the stressful part, because I said mixed feeling, is he's such a very wonderful speaker that it make my stress level go up. Okay, hope my talk also will keep you alert. Okay, not so sleepy. Okay, let's start. So this is the topic given to me: empowering patients through comprehensive care, an oncology nurse advocacy journey. So it's much on sharing my journey as an onco nurse. And may I check in this room, how many of you are nurses? Can you raise your hand? Oh, okay, thank you for your support. So those who already been practicing what I'm going to share later, keep up the good work. Okay, those that got new info or something that inspire you, maybe can bring back some bring home message. That I'm glad that you bring back some message today, and hope you can start implementing it and share with your team as well. And those who are not nurses, not forgetting, to provide comprehensive care, we need a multidisciplinary team. When we talk about multidisciplinary team, you need to know what each other is doing. So it's time for me to share with you what onco nurse do. Okay, and just now Dr. Elvin said multidisciplinary team approach, right? And the question mark is still hanging there. Who? Here I would like to share with you, if all the multidisciplinary team keep on mentioning is a multidisciplinary team approach, and not only that, said nurse must do it, then we keep on saying the multidisciplinary team will do it. Understand what I'm trying to tell you? So here I want to alert and inspire and highlight to all the nurses sitting in this room. We are part of it. We need to own the responsibility, and there's so much of things we can do. Okay? Let me share with you my journey. So this is my content. I will start sharing with you my journey. And the second part, thanks to Dr. Elvin, I may touch and go faster. Okay? And the third part, let's share what the oncology nurse can do as an advocacy to the patient. And lastly, how we empower patient to self-advocate. Okay? So this is my journey, although in one slide. Hope you enjoy my journey when I start become a nurse in year 2000, and I straight away choose to work in oncology and hematological ward. Okay, because it's my passion to be a nurse and a teacher. Actually, since young, these two of my ambition. Whenever I fill out the form. Okay, so why I like to become a nurse? Because I like the patient contact, I like to take care of them, I like to talk to them. And among all the specialized area in healthcare, oncology is one of it can fulfill my dream. Okay, I don't choose OT nurse, I don't choose ICU nurse, because those patients, half of it are ventilated, and in OT most of the patient in under general anesthesia, not talking to me. Okay, so that's how I specialize myself in oncology nursing. And I go for my post-basic training, and that era, only government hospital do provide oncology specialized training. Only government hospital. And every year they only take one intake, and each intake about 20 to 30 students, and majority of the seat they given to government nurse. Okay, so luckily I managed to fight to get a seat. But after going through the training, that time I still very junior, 20 over years. And the content of the program mostly train us about what is cancer, all types of cancer, all the treatment about cancer, and how we take care of the side effects. by all I listed out, did you realize that most of these content components are more focused in the physical care, the physiological care? But that time I was still very junior. When I come back, I serve as a specialized onco nurse. I take care of cancer patients who gone through all the disease treatment. I realized it's not enough. Okay, the patient need more, not just physical care. That's why I approach the management. We need nurse, like what Dr. Alvin said, nurses are too busy. Keep on taking care of the patient with the disease and administering the treatment. We need nurses to spend more time to talk to patient, to provide education to patient. So we started with a new position called oncology nurse educator. And this is the first role and position started in that hospital. Okay, and I'm the first educator in year 2005, and from there I can take up the role more time sitting beside patient bedside. Okay, not just hanging up chemo. When chemotherapy dry, I just press a call bell. On-call specialized nurse will come and take care of the chemotherapy, but I continue my conversation and attention to the patient. Okay, and of course I promoted as a manager, and then I supervised more junior nurses. I trained my team. I got more power to change the policy. I started more focus in psychosocial care, and also did you realize that I'm starting to more and more become an advocate that psychosocial care is important. We need the educator, and I also started arranging the cancer center with psychologists, clinical psychologists, and also we started to hire this counselor. And while we expanding and renovate, we also have the counseling room. See, to fight for a room, okay, for certain purpose, when we expanding in the hospital, you need a lot of effort because they will use the space for more meaningful, so-called income generated, right? So then I got more and more authority to do all this policy change. Then I find it's not enough because only in this hospital, but there are patients in other hospitals, there are patients coming from other hospitals, and we only got one government school to train onco nurses. And that's why I switched my role to education, because I want to start another specialized onco train program where I can nurture more young nurses, okay, and I can develop my own program. And I changed and added a lot of content into the program, included all the behavioral science, okay, the psychosocial care, spiritual care, psychosexual care, sexuality needs, nutritional care, end-of-life care, palliative care. So I got the role to play to design curriculum, and also further myself as head of school in that nursing school. And here I am today in Sunway University as a senior lecturer, because Sunway University also would like to start the program in specialized in onco nursing. Okay, so I also will design a comprehensive program to nurture more onco nurses. Okay, so this is why I thanks Dr. Elvin. Okay, I cut short. So what is comprehensive care? As what shared, it's not only just physical, it's not just cancer patient, cancer case, but the patient is a person. Okay, they do have emotion, they do have psychosocial needs, spiritual needs. And to achieve this comprehensive care, or so-called holistic care, we need multidisciplinary team approach, and not forgetting you are part of it. Oncology nurse is part of it. We are part of it. Okay, we got a very crucial role to play. From physical cares, from the moment they diagnose with the disease, with all the effect of the disease, they may have pain, the tumor is pressing their nerve, or even bone metastasis already. So And also, what if they're already started with treatment, a lot of side effects, nausea, vomiting, fatigues, risk of infections. So all these we need to take care of patient physically. And psycho, feelings better, patient not so anxiety, not so depressed. And social, they're still part of the family. How about they're worried about their work, okay? And also spiritual, how about their thank you for reminding, 10 minutes left. Quite distracting. Okay, spiritual needs, that meaning of life. A lot of cancer patients that start to self-doubt. Why me? What happened to me? What goes wrong? What is the meaning of life after this? Okay, so this is projecting the complete holistic care, yeah, comprehensive care, in short. So there's a case study that I like to share. Okay, how to play.
Put the mic back. Yeah, give her the mic.
Nothing. Try again.
And also with cucumber tumor and already in stage 4. I was truly devastated because I survived the cancer previously, but it's relapsed within a few months. I felt that it's the end of my room at that time.
You see, when patient diagnosed with cancer, they go through a lot of emotional issues, and these ladies who successfully gone through the first round of cancer fighting, and yet the cancer relapse. You can see her life is like a roller coaster, from a lot of psychological issue go to physical treatment side effects, and she happy at the outcome, and disease come back again. So with the approach of multidisciplinary team, with looking at her case as a whole, taking care of her physical, psychosocial, and also spiritual needs, she will able to go through the journey more successful. Okay.
I can say because of the positivity from the doctor. Doctors and the nurses treat me very well, and from support from family, that is the main reason make me stronger to fight cancer.
So as you can see in this case, that relapse is another very big thing that hit patient again, to be strong again second round, to able to fight again the cancer. So onco nurses play a vital role when taking care of this kind of patient, not focusing only physical but also psychosocial needs. Yeah. So what are the activities that we can do to the patient that gone through all this roller coaster patient cancer journey up and down? You see, this is the long journey that you can see. From beginning of symptom identified, they started their anxiety, then they go for investigation. And the procedure of investigation might have a procedure that never come across, like PET CT scan, okay, or bone scan, that all these scan that never hear before. Okay, so we need to give a lot of health education, and when it diagnosed, breaking bad news, see, again the Kluber rose, the grief and bereavement stages all come in, the bargaining, denial, anger, okay, and come to acceptance, and of course depression as well. And then after that, they may go for further staging investigation, again a lot of procedures, so that they can know what are the best treatment that they can apply. When doctor introducing treatment to them, chemotherapy, targeted therapy, hormonal therapy, biotherapy, radiotherapy. Hello, all these are all medical jargons, right? The drugs, what are the side effects, what they will feel when they go through these treatments, all create a lot of phobia, anxiety to the patient. And side effect management come in when treatment starts. And you see, the therapy cycles and regime may change, and if the disease relapse, if they're not responding to the treatment very well. End up with either their disease progress, then we need to apply end-of-life care, palliative care, or maybe they survive. Then during the survivorship, still got a lot of comprehensive care needed, okay, as taking care holistically. And you can see along the journey, on-call nurses got the opportunity, we are given the opportunity from beginning, okay, till diagnosis, till treatment, till changing of therapy, relapse, okay, manage of their complication, till the disease progress or even survivorship. We are the one that going through the whole cancer journey with the patient. So we give it the opportunity to offer the patient comprehensive care. So we are the person that can advocate for the patient. Although sometimes we felt that patient need to refer to a counselor or to a psychologist, but not all patients willing to accept the referral. Because as what we hear just now, mental health care, they're worried. But they are more open, talk to a nurse. They give us the opportunity to talk to them. So we are the one who spare our ear to them, listen to them, understand them, and we can advocate for them. So these are the activities that we can do for the patient during the patient advocacies, and we can provide them comprehensive and clear information, because we need to assess our patient. Some of our patients do not advocate for themselves or do not ask questions because they got unconscious incompetent. They don't even know what they do not know. They don't even know that what they need to know. Okay, so if we, after assessment, we see they are unconscious incompetent, we need to give them all the comprehensive and clear information so that they're conscious incompetent. When they're conscious incompetent, then only they will seek for clarification, they will ask for information. Okay, then with all the information we provided, then they can make informed decision making. Okay, and of course we also give them health education or potential side effects, tips to manage the side effects so that they can have more involvement, and we can develop a personalized self-care strategies, holistically tailored made to the patient, and we can become the referral person to refer to multidisciplinary team. Okay, as what I mentioned just now, the tailored made personalized patient care is very unique because every patient is different. Every patient are unique. So we need to explore further what is the patient character, what is their wishes, what is their need, their value, their preference, and along the cancer journey from screening till end of life, up and down, actually their nursing problem or so-called patient's problem will change, will varies. From beginning they may have more anxiety, more lack of knowledge, where during the treatment they got more nursing problem like side effect, nausea, vomiting, fatigue, pain, risk of infection. So at every stage we need to assess and see all the nursing problem that the patient facing, and we need to tailor it and talk to the patient which one is their prioritized, which one is their first need, which one they look into more seriously, that they want to solve it first. It's the patient choice, patient which one they want to solve it, not what we decide for them. Although for medical team we said infectious, life-threatening is more crucial, so we need to solve it first, right? But to the patient, maybe alopecia is the one that disturbing them a lot because of body image, of self-esteem. Yeah, so that's why we need to respond to patient preference. And not just advocating for the patient along the journey, actually we can encourage patient to and empower patient to self-advocate, because we cannot be with them all the time, right? So that's a lot of important and why self-advocacy is so important to the patient, because they can take an active role in their care to achieve better outcome, and they can have greater sense of control, because one of the very disturbing emotional that cancer patients have is loss of control. Okay, so encouraging self-advocacy, the patient must equip with self-advocacy skills such as informed decision making and effective communication and resilience and confidence. So this is my last slides. Okay. So a lot of onco nurses said, how are we going to help patient or empower patient to be more self-advocacy? What we can do, what a oncology nurse can take the step to promote patient self-advocacy. So here is one of the framework that I would like to share with you. Some bring home message, maybe you can try it on to help your patient, empower them for self-advocacy, is CABAP, which first is clarify. We have to clarify patient priority, patient needs and value, as I just mentioned just now, their priority. After that, we need to assess their ability to self-advocate. Is there any barrier? Is it communication barrier or information is lacking, okay, or their characteristic or their confidence level? So after assessment, then we build. After we assess, we diagnose, then we build. We build a care plan, okay, build their self-advocacy strength. How we encourage them, we provide them the information, okay, we motivate them, and then if they are patient unable to build their strength fully, then our role come in to assist them, to support them, to be with them, to guide them, even creating a diary, writing down all their problems if they do not know how to speak or cannot recall all their issue. We can even be with them when they follow up in the onco clinics. Okay, so we assist patients who struggle for self-advocacy. And lastly, not just end there, we need to continue promote ongoing self-advocacy, continue encourage patient, connect with our patient, and motivate them. So this is my last case study. If the time allow, or we can skip this. Time keeper? It's okay if we can skip this, okay? So that's just another case study to show you how successfully or effective when we apply kebab to a case, then the patient can sail through the cancer journey with a lot of us empowerment and self-advocacy, okay? And the message on so-called nagging that I want to share with all the nurses in this room, that we are playing a very vital role and we are giving the luxury and the opportunity to be one of the very important person in cancer patient oncology, cancer fighting journey. So please play our role. Please advocate for the patient, okay? And empower the patient and provide them a comprehensive care. And we can make a huge difference in patient's life. Okay, thank you so much.